Well, earlier I was joined by Dr. Bharat Pankania. He's also a Liberal Democrat councillor in Bath, incidentally, but he's talking in his capacity as an independent public health expert. Well, Doctor, it's always great to have you on the programme. Thank you so much for coming in. What's your advice this Christmas?
Oh, it's very important that we listen to what Chief Medical Officer said yesterday, which is we reduce our person-to-person interactions, especially leading up to the Christmas gathering with families. If we can reduce our exposure to the virus, we reduce our chances of getting infected.
But why should someone like me, to be honest, who's double jabbed and boosted and might have had it, be cautious?
Oh, David, it is so important because I am now getting reports of my colleagues exactly like yourself who have been fully immunized and boosted who have got infected. So it is important that we avoid encounter with the virus. And the one way to avoid encounter with the virus is to have fewer interactions with our fellow human beings. Sad though it may be, that is the way forward. Wear your mask, wear a good quality mask, wear it properly.
Do you predict another lockdown, not this Christmas, but perhaps shortly afterwards?
No, I hope not, because our population is, by and large, immunized. But what I'm worried about is that Omicron is highly infectious. So what may happen in January is a large surge in number of cases, and that may put extraordinary pressures on National Health Services. Another reason not to get infected at that critical time.
But will this wave be, as it's so infectious, will this wave be brief?
Yes, there is every potential, and this is the South African experience too, which is a sharp rise, a peak, and then a falling down at the same time. Well, we don't know, but we are expecting a sharp peak upwards, without doubt. Will it then fall down sharply or will it plateau down? Only time will tell.
Do you think doctors, public health doctors, when they recommended lockdown last year, or the year before last now actually, do you think they realised what effects that might have on people's mental health? And looking back, was that a good idea?
Oh, David, without a doubt, because you see, the health in totality goes together. So if we have lots of cases of COVID, everything else, like a pack of house of cards, also falls down. And unfortunately, people seem to have a divide of health and economy. It is never health and economy. It is health and economy. It is health and all aspects of health and economy. And the only issue is that if one of them takes up all the other beds that we have for your cancers, for your routine surgery, for your explorations, etc., then we are failing. We're failing because we're filling up the beds with COVID, which is just what we don't want to do.
Who should we listen to, though? This is the problem, because we have the government, we have the Prime Minister saying, well, you can have your Christmas party, but you shouldn't go to work, you should work from home. Then we've got a different tone from Professor Whitty.
Well, you know what where my allegiances are, David, and I would say listen to the scientists, because scientists only do one thing. We are here to give you the scientific best advice, and then the politicians make the decisions based on whatever their thinking processes are. But I think at least the scientists know the subject better than the politicians do.
We've got to leave it there. Thank you so much for coming on the programme, and have a very happy holiday, won't you?
Thank you. Wish you the same. Thank you.